COVID-19 cases are down in most states, including Illinois. New cases decreased by more than 50% in 37 states within the past 2 weeks. The 7-day average of new cases is also down 42% from the previous average, but the 7-day average of deaths actually went up more than 4%. Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
Let's talk about this judge's ruling, and I know you're not a lawyer, but as it relates to public health, the idea of a mandate, I would have thought this would have been hashed out way ahead of time. It's not like this is our first pandemic. What's going on?
Larry, this has been hashed out. We are still in a pandemic, and it's great that the numbers are going down. And I think we're going to see some major changes in the next 2 to 4 weeks. But today, they're still higher than they were at the top of some of the other peaks. It is not a good time to get rid of these mitigations right now, especially by a judge. It should be run by the public health authorities of the jurisdiction.
There was an interesting study about numbers when people return to work after recovering from COVID. What was the result?
Yeah, this is a report I just read before the show this morning from Emily Landon and her group at the University of Chicago. They looked at I think it's 143 or 243 people, and it was 43%. Of the people coming back to work had an antigen test positive. Now, the antigen is not the most sensitive test. It's less sensitive. So over 40% of people coming back to work after 5 days, even though they feel well, are contagious.
I thought you weren't contagious anymore after 5 days, even though you'd still test positive later, didn't you?
No. Oh, no. You know, it used to be 10 days because we know by 10 days, it's almost zero. That's for sure. But they shortened it to 5 days. So, most of the contagiousness comes in the first 5 days. Okay, 57%, according to Emily Landon and her colleagues at the University of Chicago. I mean, this is really not good data. This is dangerous data.
Let's get to some viewer questions. Whatever happened to the Lambda variant of COVID-19?
Well, Lambda emerged in Latin America, and it got overtaken by Delta and Omicron, and it really didn't go anywhere.
All right, how about this question? In San Francisco, people are getting their third shots of Johnson & Johnson. If my first shot was J&J and my second Moderna, should I get another shot?
Technically, you don't need one. There's been studies that have shown that giving the Moderna after the Johnson & Johnson, you get a really marvelous immunologic response, so you don't need it. Now, what's happening in San Francisco? They're very aggressive. The public health authorities there, and they have basically taken the position that Johnson & Johnson is just one shot, just like any other vaccine, and you need 2 more to be completely boosted.
All right, next question. Do those free COVID tests from the government ever expire? Will I be able to use them in the fall?
This is a good question. You better when you get the box that the government sends you, and there's 4 different brands that they're sending out. They made contracts with 4 different companies. It'll say right on there when it expires. So it could be 6 months, it could be 12 months. Please just look at the box and pay close attention to that expiration date.
All right, this person says, my family usually has a big gathering for St. Patrick's Day at a bar. The restaurant says it will check everyone's vaccine card. Is this safe?
Well, you know, by St. Patrick's Day, it may be safe. These numbers are coming down really good, and if the bar really checks everybody and everybody's vaccinated, particularly if everybody's boosted, but I doubt that's going to be the case, it could be safe.
All right, if you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health.